Hello and welcome. In this video, I will demonstrate the complete step-by-step instrument workflow for total knee replacement using the DKSORTHO Prathmesh second generation knee system on a sawbone model. We first make our incision direct in the front of the kneecap and rotate out kneecap lateral side. Now use the 8 mm IM drill to hole in the distal femur. This step on the drill will enlarge the centrous hole on the femur 12 mm. Now we set the adjustable IM alignment guide to the proper valgus angle as determined by pre-operative radiography. Our next step, attach the distal femoral cutting guide to the 0° distal placement guide. In this cutting block, we have 4 options: -4, -2, 0, +2, +4. Insert the distal placement guide into the IM guide. So next we actually will pin this little block into place. We'll put the second pin into give good stability, and next we will unscrew the placement guide. For remove IM valgus angle guide with this slap hammer. And now if we don't feel we are getting enough bone and we need more bone, we can actually adjust at this point. If we need more fixation, then use two headed pins. Now we perform our distal femur cut. Now check with angel wing that cut is made flat and smooth. Then go east and remove our pins. Now we use a sizing guide to figure out what size femur we want to use. We use this little stylus up on top of the bone to make our decision. This is our most important step. Check the stylus tip touch anterior cortex highest point. Then get our proper size of well put pins into the rotation guide. We are achieving our exact size through anterior referencing sizing guide. Now remove only the rotation and femoral size. Now same size APC jig place onto these pins like that. We need to decide our lateral medial margin at this point. Once again, check anterior notching with C guide. Now fix it with headed pins. For the additional fixation, drill the post holes using the peg drill bit. Then insert 6.5 mm peg pins through the post holes with peg impactor like that. Now we'll make our chamfer cuts. Now our complete two chamfers cut and two anterior and posterior cuts. For trochlear cut, need a small blade. Now we are screwing a Tommy bar on distal side APCC cutting block. Then remove headed pins with slap hammer. After removing the pins, remove APCC cutting block. Our next step, assemble a box cut. Position the box cutting guide onto the femoral surface, both distal and anteriorly. Once again, next step would be to remove the pins and remove the box cutting guide, helping with Tommy bar and slap hammer. Our distal femur is totally prepared. Align the rod with the medial third of the tibial tubercle. Stabilize the alignment guide by tapping the spike arm tibial plateau. The stylus insert into the top of the cutting guide. The stylus will snap into the hole, confirming that it is fully fitted. We have two tips, one 2 mm and second one is 10 mm. 10 mm stylus touch the healthiest side tibial plateau for achieving the standard cut. Stylus touching the highest point, then check with C-guide our cut is enough or not. Again, we will pin into give good stability. Unlock the dovetail knob, then slap hammer attach with spike arm and slapping back. For removing the tibial cutting zig, check before take a cut with C-guide, then fix it with headed pin. After proximal cut, check through the slot. We achieve flat and smooth tibial surface. Remove tibial cutting guide and check extension gap using the spacer guide. So that's a similar things. We want to measure the size of the tibial base plate. Next step will be to pin this hole. Next we have a little tower that goes onto this and put this in place. And we'll go down to the depth of the indication on this rimmer to make our hole for tibial component. And there is a punch with these fans called tibial broach that match up to base plate and impact it. Once we prepare the tibia, we'll go edged and remove pins. So we are go edged and we are trial with the same size implants, trial implants. Now the check range of motion. We want to check the stability of the knee. Make sure that it's all stable. Thank you for watching this demonstration. I hope this step-by-step overview was helpful.